And life-saving drugs are not exempted from the trade in counterfeit medicines. The World Health Organization is working with Interpol to dislodge criminal networks ranking in billions of dollars from the trade. In 2009, 20 million pills, bottles and sachets of counterfeit and illegal medicines were seized in a 5-month operation coordinated by the International Criminal Organization Interpol across China and 7 of its South Asian neighbors. 33 people were arrested and 100 retail outlets closed. Now, for more on the struggle to tackle the sale of counterfeit drugs, I am now being joined by Dr. Chibuzo Opara, a medical doctor, for more. Many thanks to you, Chibuzo Okpara, for joining us on this hour. You look at the report from the World Health Organization. It says that in Africa, 1 in 10 drugs are fake. And then NAFDAC in Nigeria says that if one person buys 10 drugs, there's a possibility that 7 out of those 10 drugs are fake. Why do we have a persistence of this challenge?
Thank you very much, Precious. So the problem with fake drugs and counterfeit drugs in Nigeria is that we have a fragmented supply chain. So you have all sorts of unscrupulous individuals taking advantage of our fragmented system. At Drugstock, what we try to do is to create these bulletproof supply chains between manufacturers and hospitals.
What do you mean fragmented supply chain?
So when you look at the supply chain system, you typically want to have the drug leaves the manufacturer's warehouse straight to the hospital or the pharmacy. In Nigeria, you have several middlemen that it passes in between their hands, and you have issues related to people bringing in drugs into that supply chain because it's not, consolidated or completely wholesome. So what people do is, if you have, 500 products that you want to bring in, say, and then you say, okay, I'm going to bring in 200 more and bring it in from some bad location. So that's what typically happens with counterfeited drugs. You also have issues related to storage because these middlemen are not usually pharmaceutical oriented, don't really understand or care about the eventual last mile where it's going to, because for them it's just about profit. It could be biscuits, it could be drugs. So what we try to do in the professional part of the system is to ensure that we can create single units where everything just goes straight from the manufacturer straight to the hospitals and pharmacies.
For those who don't know, counterfeit drugs are drugs without active ingredients at all, right? So we have the middlemen, we have majorly between manufacturers and consumers. Even before it gets to the hospital, we have NAFDAC and we have Standard Organization of Nigeria. From what we understand is that these drugs don't even go through these organizations at all. It's from the fake drug producers straight to pharmacies where people get to buy them. So how do we bridge that gap to ensure that, especially for Nigerians who don't go to the hospital, straight to the pharmacy to buy drugs, how do we bridge that gap so that people stop buying directly from pharmacies?
So the issue with the supply chain in Nigeria, and first of all, you have to give credit to NAFDAC and SON because they're trying quite a bit. But the issue is that it's just such a big market and there's so many parallel points that drugs get into the country. When you look on the shelves of a lot of pharmacies, you find that the amount of drugs range in the thousands. And the regulatory authorities are often pressed for manpower to try to enforce all the rules and all that. You also have a lot of open drug markets where people trade, buy and sell things that might not necessarily have passed through the scrutiny of the authorities. So you don't want to, most times you don't want to peep behind what's happening in the supply chain. But there is a huge revolution right now in the sector with regards to the professionals, with regards to the private sector organizing bodies around supply chain. Companies like Drugstock, like ours, companies like, with support of the authorities are working on trying to ensure that, this issue of fake drugs is something of the past. We're a country of 200 million people. It doesn't really make sense that we should be suffering from these type of issues when a lot of it could be solved from just organizing and putting our act together. And that's what we are always trying to do in the private sector when it comes to distribution, working with a lot of the manufacturers, because they are also worried about the fact they want to know where their drugs end up, they want to know what is happening, they want to ensure that the patients get the right drugs at the right time, the right place. And that these unscrupulous middlemen who take advantage of a fragmented system don't are eventually, eased out of the system and eased out of the market. So it's a constant battle every day, and we win small fights and small battles every day, and eventually we're going to win the war.
Hopefully we win this one. Many thanks to you, Dr. Chibuzo Okpara, for your time.